Hello and welcome to Lautco's 2017 to 2018 Insurance Benefits Enrollment Meeting. We are Partners Insurance Advisors, and it's that time of the year to discuss your plan options, choosing what benefit options are best for you. So, let's get started. Today's agenda will go over your Benefit Acceptance Guide, Alira's MEC Plan, Humana's Base, Buy-Up, Dental, and Vision Plans. The Benefit Acceptance Guide details all the coverage options available along with pricing. The first is Alira's MEC Plan, then Humana's Base Plan, and then Humana's Buy-Up Plan. Below is Humana's Dental Plan and Pricing. Finally, at the bottom, Humana's Vision Plan and Pricing. We'll need this page completed and returned so we can enroll you on the correct plan you choose. Remember that you can choose to customize your insurance package. For example, you cover yourself on one of the medical plans, then choose to cover your spouse and children on the dental and vision. Be sure to examine all options and then best select what fits your needs. Next, I'm going to go over the differences between the plans so you can choose the best option that fits you the best. The first option is a MEC, which stands for Minimum Essential Coverage Plan. Through Alira Healthcare, Lautco decided to offer a MEC plan to provide a low-cost option giving you minimum essential coverage. If you choose this plan, remember that it is not insurance, but coverage that will give you the basics. Some of these basics include 5 primary care visits with a $20 copay, unlimited telemedicine visits, free preventive care, and 2 urgent care visits with a $20 copay, to name a few. Now, to remind, this will not function as insurance. In other words, it will not provide hospital coverage, no prescription coverage, and no ER coverage. However, obtaining this plan does protect you from the government penalty because this plan qualifies as an ACA compliant plan. Now, going a little further, a tip we do recommend to address prescription needs is to visit goodrx.com. This site is a helpful tool that will show you which local pharmacies charge the least for most medications without using insurance. To add further convenience, they also have an app you can download on your iPhone or Android device. Using goodrx.com along with this MEC plan is a good combination to get basic coverage with some prescription assistance. We recommend this plan for anyone that does not have much need for health insurance, wants to cut their cost, while getting basic preventive care coverage. Next up is Humana's Base Plan. Keep in mind that for demonstration purposes, I will be referring to the actual Humana benefit summary, pointing out the highlights. What you have in your hand will be a single-page summary of these highlights, providing you a quick reference tool. As you see here, the Humana Base Option 25 Silver Plan consists of an individual $5,000 deductible. Remember that this deductible applies to your major medical catastrophic occurrences. Anything above the $5,000 deductible will then be shared with Humana at a 50% co-insurance percentage. Then, as you see, your out-of-pocket max is $6,500. So, for any high medical bill, this would be your worst-case scenario. After you meet this, Humana will cover you at 100%. Keep in mind that all of your copays at the doctor, pharmacy, ER, and urgent care apply towards this out-of-pocket $6,500 max. In other words, you get credit for these. Let's move on down to review your copays. Your primary care copay is $40 and your specialist copay is $80. Remember that for all preventive screenings, they are covered at 100% by Humana. Next are your prescription copays. Under this plan, you have a 5-tier system. This page shows your level 1 and level 2 tiers. Level 1 meds are $10, level 2 are $20. This next page shows your level 3, 4, and 5th tiers. Level 3 meds are $50, and levels 4 and 5 are a 50% split. ER is a $550 copay, but will be waived if you are admitted. Urgent care is a $100 copay. The third and final medical plan is the Humana Option 22 Buy-Up Plan. As you see here, this Humana Buy-Up Plan consists of an individual $2,000 deductible versus the $5,000 deductible on the base plan. Also remember that just like the base plan, this $2,000 deductible also applies to your major medical/catastrophic occurrences. Anything above the $2,000 deductible will then be shared with Humana at a 50% coinsurance percentage. Then, as you see, your out-of-pocket max is $6,350 versus the $6,500 max on the base plan. So, for any high medical bill, this would be your worst-case scenario. After you meet this, Humana will cover you at 100%. Keep in mind that all of your copays at the doctor, pharmacy, ER, and urgent care apply towards this out-of-pocket $6,350 max. In other words, just like the base plan, you get credit for these. An important item that needs to be discussed is the fact that this plan, unlike the base plan, has a prescription drug deductible. This deductible, as you see, is $100. What this means is if your doctor prescribes you a level 2 or higher medication, you have to meet this $100 calendar year drug deductible before your level 2 and higher copays start. Level 1 $10 generics do not apply to this deductible and will always be $10 immediately. Next, let's focus on these prescription drug copays. So, as you know, level 1 medications are $10 right off the bat. Remember, you do not need to meet your $100 deductible if you obtain a level 1 medication. Level 2 medications, after your $100 deductible is met, will then be a $40 copay. Level 3 meds are $90, level 4 meds, 25% cost, and finally, specialty meds are a 35% cost. Since we're on this page, let's review other important copays. The ER copay is $500, but will be waived if you are admitted. Finally, urgent care copays are $100. Last but not least, your primary care copays are $40, and your specialist copays are $70. And, just like the base plan, all preventive services are covered at 100% by Humana. So, these are the 3 medical options available to you. The next natural question is, which plan is best for you? You have to ask yourself, am I planning on having any major medical procedures done this upcoming year? Examples include surgeries, getting pregnant, diagnostic tests, etc. If this is you, you can automatically exclude the Alira MEC plan, possibly the Humana base plan, and consider the Humana buy-up plan. This buy-up plan is designed to limit your medical costs the most compared to the other 2. Now, if you don't have any procedures planned but still want all-around comprehensive coverage, then I would highly consider the Humana base plan. This plan is lower in cost compared to the other Humana buy-up plan, but still gives you manageable copays for doctor visits, medications, and of course, coverage for the accidents, illnesses, hospitalizations that are out of our control. Lastly, if you really just want to save as much money as possible, but still have minimal and basic coverage, knowing you don't have any medical needs, then I would highly consider the Alira MEC plan. Also remember that this plan is fully ACA compliant, meaning having this will protect you from any government penalty for not being insured. In addition to medical coverage, Lautco is continuing to offer Humana dental and vision plans. The details are as follows. All preventive services are covered at 100%. This includes your exams, cleanings twice a year, and x-rays. Now, let's say you have a cavity and need a filling. The filling falls under basic services, where you would then have to pay a $50 calendar year deductible, and then Humana will cover 80% of the cost. If you need any major services such as crowns, dentures, bridges, you would also have to meet that $50 calendar year deductible, and then Humana will pay 50% of the cost. Note that the annual max under this plan is $1,500 per participant. Lastly, child orthodontia is included, where Humana will pay 50% with no deductible up to $1,000 lifetime orthodontia max. Next is your Humana Vision 130 plan. As you see, you have a $10 exam copay that includes dilation if necessary. If you're getting contacts, you will also have to pay a $55 fit and follow-up fee. Next, you have a $130 allowance you can use and apply towards any frames you want. Anything over, then you just pay the difference. For your lenses in your glasses, you just pay a $15 copay for either single vision, bifocal, trifocal, or lenticular lenses. Further, if you wish to add options such as UV coating, scratch resistance, anti-reflection, then you just pay the designated copay. Finally, if you get contacts, then you also have a $130 allowance that you can use and apply towards your cost. Now, it's very important to remember that you cannot use this benefit for both contacts and glasses if you wear both. You have to pick one and use one or the other. Lastly, remember that the frequency you can go is clocked from the last time you visited. For example, if you went last September 2016, then you are now eligible for your new exam and lenses in September 2017. It does not reset every calendar year like your medical and dental deductibles do. Be sure to select a great pair of frames though, because you have a 24-month frequency. One last item to touch base on is Humana's Go 365 Wellness Program. The biggest takeaway to remember is just how easy it is to earn points and Go 365 bucks. You automatically earn points for tracking your everyday steps, getting a flu shot, going for your dental checkup, or vision test. Also, tracking your activities such as walking your dog or riding your bike. Anyone can do it, and the reward is you get to go shopping in the Go 365 mall. You are able to redeem your bucks for various gift cards, such as Macy's, Target, Lowe's, Apple, or my personal favorite, Amazon. For all of you current Humana members, don't forget to log into your Go 365 account to see just how much you currently have and go shopping. This concludes our 2017 to 2018 Lautco Insurance Benefits Enrollment. If you have any questions, please don't hesitate to contact us at either 210-569-0942 or service@pia-tx.com.